Just saying a welcome for those that have joined us this afternoon for our webinar. As Daisy's popped in the chat, for those that are joining, we'll be starting. We're letting people in, and then we're going to be starting around just before 2:05. So if you need to grab a drink, please do so. And yes, Leanne, I'm sure Daisy will put it in the chat. You will have a copy and a copy of the recording. And we have muted and turned cameras off, just so that you're aware. Afternoon, and a big welcome for those that are joining. Daisy's put it in the chat, but just to say we'll be starting about 2:05, just giving time for people to enter. So please do grab a drink if you've not got one, and thank you for joining us. We'll be with you in a couple of minutes. Hi, welcome everyone. Thanks, Megan. There isn't any sound at the moment. We're just waiting for everyone to join. We've got quite a lot of people joining us. Thanks, Gemma. Yeah, there wasn't any sound, so we're just waiting for a couple of minutes, just so everyone can join. So at 2:05. But welcome this afternoon. Thank you for joining us. 2 minutes. Ola, if you still can't, Daisy will write in the chat. If you've got anybody that can't hear, it's probably your settings. So please do leave and rejoin. It should be okay then. Hi, Kay from Chrysalis. Lovely to see you here. And do as Daisy's put in, please do use the chat to introduce yourselves. And as we move through the webinar, use that to ask any questions. I'll start the introduction in just 1 minute now. We'll get going on the webinar.
think we're good to go, Judith. It's
Yes.
slowing down on the admissions, so ready whenever you are.
Lovely. Thanks, Daisy. Thanks for managing the chat there. So, for those that are just joining us, welcome to our webinar this afternoon. It's so great to have such a great number sign up and join us this afternoon. So today our webinar is around relationships, recovery and supporting children whose parents have caused harm. And that's between us, me, Judith Rees, Chief Operating Officer at the For Baby's Sake Trust, and with the UK Trauma Council and Children Heard and Seen. David and Sarah, I wonder if you can come on camera just to introduce yourself briefly.
Hello, I'm David Trickey. I'm a clinical psychologist who specialised in working with traumatised children, young people and family, particularly with domestic abuse and domestic homicide, and I'm also co-director of the UK Trauma Council.
Thanks, David. Thanks, Sarah.
Hi, I'm Sarah Burrows. I set up a charity, Children Heard and Seen, supporting children with a parent in prison in their community. And today to talk about children that we support when one parent has killed the other and is serving a custodial sentence.
Thanks, Sarah. So, as we move through the session today, it's an emotive subject, so please look after yourself. The themes we'll be discussing could be difficult or triggering for you, so check in with yourself throughout. Pause, breathe, step away if you need to protect your emotional safety, because your well-being comes first. And always reach out to support in your organisations or ourselves afterwards if you need to. Today we're going to explore the role of relationships in maximising the chances of children's recovery, children's relationships with parents who have caused harm, the psychological and developmental impact of trauma, the effects of domestic abuse and post-separation abuse on parent-child relationships, how professionals assess risk and make decisions that truly keep the child at the centre, and the role of family courts and social work, including the importance of safe, informed contact decisions. And we've got an hour, so we're touching on these subjects, but as always with our webinar, it's about opening up these conversation awareness and influencing our practice. That's just the agenda there, as Daisy's put in the chat. The cameras and mics are turned off, all attendees, but do use the chat throughout and mute notifications if needed, if you've got pinging going on. And as Daisy said, this webinar is being recorded and the recording will be distributed after the live, after we finish the recording. So I'm just going to do a few introductory slides before I hand over to David. And to start us off, a reflective question, that would be good if you could use the chat function to think about what might be the thoughts, feelings and experiences of children whose parents have caused them harm. So just a moment to pause and reflect and use the chat function to think as you're entering this webinar, what you think those thoughts and feelings and experiences may be of children. As you're thinking and pausing and popping that in the chat, just thinking about children's relationships with a parent or parents who have caused harm, we know will be complex and could include a mixture of anger, fear, grief, guilt and love. And we know that positive relationships are more likely when the parent has acknowledged the responsibility and demonstrated sustained behavioural change and are taking steps to build trust and provide emotional safety. That is child-centred care. Children are victims of domestic abuse in their own right, and that was implemented from the Domestic Abuse Act in 2021. And domestic abuse impacts parent-child relationships by undermining children's sense of safety, that's both physical and emotional, their care and emotional security. Domestic abuse can also impact the ability of the parent experiencing abuse to provide consistent, responsive care due to the impacts of it on themselves. And we know that post-separation abuse is common. Children are direct victims of post-separation abuse, impacting their health and well-being. And this can also impact the parent-child relationship, as we'll hear more about. Children and their parents can also be re-traumatised by the systems built to protect them from harm. And so it's really thinking about our practice to really reduce that as much as possible. One of the models that really helps us to think about the impact on children is the family stress model, as you can see referenced here. And really, this is sort of a wider model thinking about those stresses such as domestic abuse, financial hardship, relationship conflict affect children's outcomes indirectly by increasing parental stress and reducing the quality of parenting and family relationships, which in turn then influences child development and well-being. So you can really see in the simple diagram about how that ripple effect from that parental stresses impacts the child. And I know David's going to build on that in his talk slides. What's often not spoke about and what we do at the For Baby's Sake Trust is really thinking about how that starts in the womb and how toxic stress can impact right from the unborn baby. And we know there's 3 types of stress that children can experience, from positive stress, buffered, sometimes known as tolerable, but also toxic stress. And toxic stress happens when a child experiences severe, and it's really important, severe and ongoing stress without consistent supportive relationships. And toxic stress affects the way that children's brain develops and can lead to lifelong problems in learning behaviour and both physical and mental health without the right support in that preventative care. And you can just see there how cortisol can flow from the mum through the womb, through the placenta to the baby before it's born. And another diagram really just to think about the impact of domestic abuse on parents. So when you've got a parent that's abusive in the context of domestic abuse, how there's direct impact and harm on the child from the person perpetrating that abuse. But then also the second arrow there is the child or the baby experiencing and seeing the abuse on the non-abusive parent. And then number 3 there across is where the parent causing harm is able to influence and damage the relationship between the non-abusive parent and that baby or children. And then 4, there can be the parent causing harm limits the non-abusive parent's ability to parent the child. So from all angles, the baby or the child is being harmed. And then also really thinking about the holistic and the systems around that baby or child and how the behaviour negatively impacts not only on the child and the person experiencing the harm within the family, but the family's ecological and functioning systems around the child, including school, community, etc. So what are the roles of relationships? We know that relationships heal relationships and connections. And this is from a paper that really ties in that adverse childhood experiences create significant risks for problems in later life due to those enduring and damaging consequences. Interventions are essential to prevent or mitigate impact, which is why For Baby's Sake we work where there's domestic abuse starting in pregnancy, to really help to prevent those adverse childhood experiences moving down in generations. One form of support is the role played by trusted adults in the lives of vulnerable children and young people. And whilst the idea of supportive relationships may reflect the social work values when we're thinking about support around the family, there can be legal, procedural and bureaucratic barriers that can really impact on how those relationships and that support can be put in. And so other adults around that baby or child are so important, that associated with the formal services such as teachers and youth workers, as well as extended family and community members, may potentially be able to do that as well. And so it's that whole system supporting that baby and child, but ultimately supporting those parents as well. And also it's really important that parenting interventions that aim to help parents strengthen their relationship with their baby or child, promote the core elements of underpinning the principles of trauma-informed approaches, and these are from the Understanding Trauma-Informed Practice from NHS Scotland, which is realising that it happens, really being able to recognise, respond and then resist that re-traumatisation is as well. And again, we're just touching on this trauma-informed approach, and it would be a whole webinar within itself, but it's good that David and Sarah are going to unpack some of this as well in their slides. At the For Baby's Sake Trust, we've got trauma accreditation silver level with Once More thing, which really means that our work at the trust across our teams, but also with the families we work with, are underpinned with safety, trust, choice, empowerment, collaboration, and cultural consideration when we're working with families and their children to be able to get the outcomes that we need. And just to my final slide really is moving in to really think about keeping babies and children at the centre of our work when we're working with those parents that have caused or are causing harm. And that's really to understand the different ways that babies and children communicate, always hearing and including the baby's or child's voice in assessments and arrangements, using a range of communication methods depending on the child's needs that we're working with, always consulting with the other professionals and the systems around the child to understand the voice of the child from different perspectives. At the For Baby's Sake Trust and lots of other wider services use tools such as the newborn behavioural observation or video interaction guidance, because it can really help us alongside working with parents to help to interpret needs, vulnerabilities and responses that the family needs, including the baby and child. A big one really is not to assume we know what a child may think or feel. Every child is different, and also within the same family, every child is going to have experienced and needs will be different. And really important comes back again to the connections and building relationships with families as professionals. Spending time getting to know them is the most important way to hear and understand their voices and views. So hopefully that's laid some foundation as we move through to David and Sarah. So David, I'm going to hand over to you. Hopefully you'll be able to take control of your slides.
Hopefully, and hopefully I can do that without sharing my Spotify playlist. You don't need to know I was listening to Barry Manilow before this. Hello, everyone. Thank you so much for taking the time. It's a real privilege to be with you this afternoon to share some of our ideas about how trauma works. So I work at the UK Trauma Council some of the time, which is an organisation where we try to produce resources to help those of us working directly with traumatised children, young people and families. And the resources that would be particularly relevant to this group, I think, we have a whole suite of resources about childhood trauma and the brain, which really tries to explain how a child's brain adapts to their environment, including their traumatic environment, how that might go on to cause problems, and really importantly, what we can then do to respond and to mitigate some of those difficulties. And interesting, when we produced that resource, initially we called it Childhood Trauma and the Brain, but because so much of what we can do to alter a child's outcomes is about relationships, we've now called the set of resources Childhood Trauma, the Brain and the Social World, because that's such an important part of it. We also have resources for parents and carers, supporting children, young people after potentially traumatic events. Just as a basic Q&A really, where people are saying, well, should we talk about it? Should we not talk about it? What can we do? What shouldn't we do to try and create the environment for healing? And we also have a community of practice, which brings in practitioners from all sorts of different backgrounds and trainings and agencies to try and help each other and to work through some of these dilemmas with each other. So I just wanted to let you know what we're doing at the UK Trauma Council, and hopefully there's some things that would be of use to you. What I wanted to do really was describe our best understanding of how trauma works. Do you know, what is it that makes a potentially traumatic event actually traumatic? What are the mechanisms, if you like, of trauma? Sorry, my slide isn't quite doing what I expected it to do. There we go. So one of the ways we understand trauma is using the cognitive model of PTSD. Don't be confused by that. It's not just about cognitions and it's not just about PTSD, but actually this is a way of really understanding how events end up affecting children, young people, and indeed adults. And the model suggests that it might be because of the memories you have for events. That might be what's causing the problem. It might be because of the meaning that you give to events, and it might be because you are maintaining the problems, usually through avoidance. So there's these three aspects And I really want to focus on talking about the meaning bit of the story, because I think that's also where the relationship comes in. So we have these beliefs, these expectations about ourselves, about the world, about other people, the way that things are supposed to work. And those beliefs are a bit like a lens that then colors the way that we see things. So we see things through that lens, which means that we kind of find a way to make things fit with how we think they ought to be. Rather than changing our beliefs all the time, we tend to try and squeeze things in to fit in with our beliefs, and we may even behave in a way that fits in with our beliefs. But what happens when events come along that are too big to ignore or distort? Well, then our beliefs do change, and we end up with a new view of the world, of ourselves and other people, which will lead to other thoughts and other feelings and other actions. So we have that traumatic events. If you like, some people talk about shattering the assumptions and how that then changes the way that we assume things are supposed to work. But we also have those traumatic memories that will intrude and remind us. So, for example, if the message of the traumatic event is the world is really dangerous, well, we also have those intrusive, very vivid, frightening memories to remind us of just how dangerous the world is. But it might not be a one-off sudden event that shatters the assumptions. It might be multiple events that come along one after the other. And it's this repeated drip drip effect that ends up coloring the way that we see things. And then when those events have stopped, we're left still with this particular traumatized view of the world. And some of the legacies, if you like, of traumatic events might be assumptions about the world. Might be people believe the whole world is dangerous, not just that home at that time, but actually everywhere. They might believe the world is unpredictable. We like to cling to the idea that things are going to make sense, there's a reason, but some traumatic events kind of take that rug from under the children's feet and they suddenly see the whole thing as unpredictable. They never know what's going to happen next. They might start to believe that other people cannot be trusted. They might believe that other people are dangerous. They might believe that they are unlovable. They might believe that they are vulnerable. They might believe that they are to blame. And it was interesting, that little exercise you did right at the beginning, the amount of things in the chat that were really about the way the child sees themselves, the world, or others. And I think that what the blame one is a particularly interesting one, which I just want to pick up on a little bit. I'm going to tell you about a girl, Anna, 10 years old, whose father killed her mother after a long history of domestic abuse. And she started to believe that it was her fault and that she should have stopped it, because very often we want to cling to an idea that the world makes sense, things happen for a reason, and that we have some sort of control. But when something like this happens, well, how can you cling to that idea unless you create a story that it was your fault? So if you believe it's your fault, okay, so things happen for a reason, it's my fault, and I've still got some control, I didn't stop it from happening. So the price you pay for clinging to the idea the world makes sense and you have control is that you end up feeling it's your fault or believing that it's your fault. And then, of course, she also had the traumatic memories that would intrude and remind her of what it is that she did. So the first time I met her, she said, it's my fault. I said, oh, that's an interesting idea. She said, if I hadn't given Dad the key that day, he wouldn't have killed her and Mum would be alive. And I said, have you ever told anyone else that's what you think? And she said, I used to, but people told me I was stupid for thinking that and I should stop it. And you can really understand if she said to someone, perhaps her granny, oh, I just think it's my fault. You can really understand how some people would say, oh, don't be daft. Of course, it's not your fault. But that doesn't help them to think through that thinking and to correct it, because actually it's just adding to the avoidance. So Anna, every time she would think, I can't believe I did that, it's my fault, that's such an overwhelmingly distressing thought, she would push it away. Other people would tell her not to think that. So she didn't get to recalibrate her responsibility. She'd have that intrusive thought, it's my fault, I can't believe it, and she'd push it away. So all I did in therapy was provide her the space and the time and the support to rethink things through. And I was just sort of relentlessly curious I wanted to understand more. Tell me more about that. So let me write this down. And we wrote it down on whiteboards and post-it notes. And over time, she was able to correct her logic, if you like, or at least to change her logic. I didn't do anything fancy. I wasn't a particularly, I wasn't doing cognitive restructuring. I was just giving her the time and the space and the capacity to rethink what had happened. That doesn't have to be done in therapy. That can be done with a pet. It can be done with a parent, with a carer, with a teacher, with someone else that just provides them that space to think things through. Winnie the Pooh says a thing when it's inside your head seems very thingish, but when it's outside of your head and has other people looking at it, it doesn't seem so thingish anymore. And that's really what we did, Winnie the Pooh therapy. She's got this thing going on. It's my fault. I can't believe it. It's my fault. I can't believe it because I did this and I did this, but then he did that. So just that relationship provided her the space to rethink and to rebalance the way that she saw things. Now, how do we create the environment where children, young people, and families are most likely to recover? For me as a clinical psychologist doing a lot of trauma-focused therapy, how do we put me out of a job? How do we create an environment where people don't develop PTSD and they don't need therapy? Well, the really good news is that the hard work has been done for us. A group of 20 authors led by Stephen Hopfall in the US looked at the evidence and came up with 5 principles. How do we create that environment where people are most likely to recover? And what I love about these principles is, first of all, they're based on the evidence. They didn't just make them up. They looked at our very best understanding of how trauma works and what makes it less so. I love it because these are completely sensible. There's nothing out of the ordinary here. I love this because these are principles, not a prescription. Doesn't say on day 3 do this, week 12 do that. It says you want to help someone recover, think about these 5 principles. And the other thing I love about this is that this doesn't need to be a clinical psychologist in a clinic where you have to have a referral and wait however many years until you get to the top of the list and then get some help. These are things that everyone can be providing: teachers, carers, lunchtime supervisors, sports teachers. All the people in the child's life can be helping to provide some of these things. So the first is a sense of safety. How do we help someone to feel safe despite what's just happened to them? The next one is a sense of calm. Sometimes following trauma, people get stuck on a level of threat appraisal. How do we help them to bring down that level of arousal? A sense of connection. How do we help people to feel connected? Sometimes after traumatic events, people drift away rather than drift towards. A sense of control. How do we help them feel in control? And how do we help people find a hopeful path for the future? How do we help them to think about the future in positive ways? I'm just going to say a bit more about the sense of connection in particular, because today we're focusing on relationships. We know from an awful lot of research that people cope better with events when they don't feel isolated or alone. We did a meta-analysis of risk factors for PTSD, which is where, because I'm too lazy to do my own research, I just harvested other people's data and basically took the average. So we took about 62 other studies of traumatized children. What would predict whether they did well or whether they struggled? And one of the biggest predictors was social support and lack of isolation. So we know that children and indeed adults that feel supported, feel there's other people there to look after them and to help them, are much less likely to struggle. Now, that might be that sort of protects some of those ideas they have. The whole world is dangerous. Oh, but I'm here with my family. I'm here with my friends. I feel safe here. So maybe that stops them from believing everywhere is dangerous. Maybe that support and that connection also allows them the opportunity to think it through, just as I explained with Anna. They get to talk it through. If you have a tough day at work, you probably talk it through either with your partner or your pet, depending on your pet. And it's our way of making sense of things. And as social creatures, we're much more likely to do that with someone else. So in whatever our role is, we need to be looking for those opportunities for young people to feel supported and connected. Who are the people that they can draw on? Who are the people they can connect to? Are those people able to make the time to connect with them? If I work with a young person for an hour a week, that means there's 167 hours when they're with other people, teachers or carers. Is there something I can do in my role to support those people to be supportive of the child? Let's look out for those who are isolated, and let's make sure that those different people involved in a child's life are well connected as well. So there's some consistency between the messages that they're receiving. And thinking about connection, I just wanted to finish really by talking about the contact with parents who have used abusive behaviors. A lot of my work has been with children where one parent has killed the other. And very often people assume that they should not and cannot have contact with the parent who's usually now in prison. And sometimes my role is to just help everyone to take a breath and let's think this through. Are there any possible advantages of having some sort of contact? And when you listen carefully to the children's voices, some of them don't want to see them. Some of them would just find it overwhelming and awful. But some of the children are worried about that parent and they want to know, are they okay? I haven't seen them for 6 months. No one has told me, are they okay? So actually, if they have some sort of contact, they can be reassured that that parent, despite what's happened in the past, is okay. It allows them to have a different experience of that parent. So if the last time they saw them was in this violent, murderous rage, that's terrifying. But if they then get to see them in a very different situation and a very different level of arousal, where they can have a conversation and where they are calm, that can be really reassuring for them. And it also means that they can receive apologies, explanations, and answers. So some of the families I've worked with, the young person's been able to go to the prison if the person is in prison, and usually the father has been able to say, do you know what, I'm really sorry about what happened. And I know sorry doesn't cut it, but as you know, me and your mum, we would argue that night I'd had too much to drink and I hurt her too much, and I'm really sorry about it. What I did was wrong, and that's why I'm here in prison. And let me know if there's anything I can do to help and support you. Do you have any more questions? That can be incredibly helpful for a young person to be able to ask those questions, to express perhaps how cross they are with them or whatever it is. So I think if we think through carefully, not necessarily just rule it out straight away, what is going to be best for the child? What's going to help them recover and heal from that trauma? What's going to help them to recalibrate their beliefs about themselves, the world, and other people? What's going to help them to feel safe and calm and connected and in control and hopeful about the future? Thank you very much.
Thank you so much, David. Really informative. I'm going to take back control. Brilliant. Lots of claps there. Thank you so much. Really powerful. Now I'm going to hand over to Sarah. I'll move the slides along for you, unless you want to take control. But otherwise,
No, just
are you happy?
Yeah.
Good.
Yeah. Do you want to just move to the next one then? So, as I said earlier, we're a charity that supports children with a parent in prison in the community, and we're currently supporting about 450 children, and the parents are obviously in for a range of offences. We decided that we wanted to make a film to highlight the voices of children when one parent has killed the other and was serving a custodial sentence. So we're going to show you a clip of a film. I'm really happy it's on YouTube as well, so you can sort of access it and watch it afterwards. It was two boys, Harry and Jordan, and they were second and third children from Children Heard and Seen that were supported. They did come quite late to us, as in they were teenagers, but we had only just set ourselves up then. And since then, we have had quite a number of children when one parent has killed the other and serving a custodial sentence. We launched this film up in Westminster last October. And the Joanna Simpson Foundation funded us, and we co-hosted an event in Westminster. And from that, adults started to come forward whose parents had killed the other when they were children. So Do you mind showing the film now?
No, it's great.
Thank you.
Thanks, Sarah. And it's very powerful. So just to let, it's about 10 minutes. So sorry, Sarah, were you going to say something? Yeah.
No, that's it. Great. Thank
That's
you.
great. Okay. Tells a powerful story. Just so I'll hand over to you now, but yeah, just apologies for those that able weren't to get that connection, but hand over to you for the next slide, Sarah.
Yeah, could you do the next slide, please?
Yeah.
Thanks. So on there is there were 2 quotes about children that were impacted, not 2 statistics, sorry. We just don't know how many children there are. This is an estimate. In the same way, we don't know how many children have a parent in prison. Bold Data made an estimate of how many children have a parent in prison, but we don't know who these children are. And as a charity, not in terms of domestic homicide, but supporting children with a parent in prison, 1 month last year, we have 5 lots of children living on their own, getting up every day and going to school because there isn't a mechanism to identify and support children. I go to the next slide, please. So we wanted to but we were having an increasing number of children that were referred to children heard and seen when they had been a victim of domestic homicide and the other parent was serving a custodial sentence, mainly men, but some women. And once we had made the film trying to raise awareness, as I said for the film, adults now who were children started to get in touch. So can we go on to the next slide? Sorry.
Okay.
So we thought what we would do is we would set up an advisory focus group for adults who had experienced this as children, and what was it that they thought would help them as children? What was it that they would like? And the group is not a therapeutic group. It is actually a focus group, and we actually look at different actions of what they think they'd wanted. So the first one we met down in Westminster, came together. It was quite emotional. We've got 12 adults that attended who had been impacted by one parent killing the other, and in fact all fathers. Some, all obviously being able to retain parental responsibility, and some having to go back to live with the parent when they really hadn't wanted to. So it was really interesting group, and we took notes in terms of what they would like to happen, and I'll cover some in the slides, but if anyone wants me to send them, then you're really welcome to have them. Could we go on to the next slide? And one of the things that we were really fortunate actually in setting up the group was that it coincided with doing a interview on Women's Hour, and that also coincided with children and young people bereaved by domestic homicide from Edinburgh University. John Devaney was one of the co-authors and was also interviewed, and one of the members of the group did a very long interview that was really good on Women's Hour. I would urge you to listen to it in terms of what her experiences were. Anyway, currently we have this group. We meet every 3 weeks. We now meet online to make it easier for people to access, and we meet on an 8 o'clock on a Monday evening, the time that seems to work. But we have 15 active members of the group that continue to attend, 12 that had one parent killing the other, serving a custodial sentence, and then 11, and then 4 family members, either who looked after children or who are now currently looking after children impacted by domestic homicide. In the film, Eddie Duggan mentions about Jade's Law. It's not enacted. Hopefully it's going to be in December this year. But at the moment, we are supporting a number of families that children heard and seen, and the children are still being controlled by the person in prison that has committed this offence, and whether it's stopping them going on holiday, changing schools, changing their names. Anyway, it will be implemented, hopefully, the MOJ are saying, in December, but one of the actions from the group is that they would like it retrospective. For families we're now supporting, they would like that if it's coming in. They also would like, these were the key things, again, I'm really happy to send the actions to people. They would like a national register of children bereaved by parental homicide, because we just don't know. And one of the things from it that Jess Phillips stands up each year and talks about killed women, and they would like someone to stand up and talk about the children left behind parentless by one killing the other and serving a custodial sentence, and also developing a knowledge base. There, in terms of, although there's some research out there, there's very little research about having your parent imprisoned for committing the offence. And so John Devaney is going to put a proposal together for us because the group is really keen to take that forward. The next slide. And yeah, final one, sorry, find us on social media. But if anyone wants any information, then do just get in touch.
That's brilliant. Thank you, Sarah, and thank you, David. And you can see all the amazing comments in there. And what we've been hearing, and we'll come to the questions now, Daisy's popped on camera there, is really that important of relationships, connections, but for these children feeling noticed, feeling heard, and their feelings validated. But lots of hope too, is what I've heard through those talks as well. So, Daisy, shall we have a look? Is there anything, David, do we want to come off?
Only that there was one question Daisy forwarded about support for those of us doing the work. So I wouldn't mind just answering that if that's okay.
Absolutely. Yeah,
I think that's such an important question. I'm so glad somebody asked it. And one of the important things about being trauma informed is a phrase that people are throwing around a lot at the moment. It's not just about the customers or the service users, the people we're seeking to serve. It's about ourselves and our colleagues as well. Realizing that many of the workforce have also experienced traumatic events either before they came to work or sometimes at work. And how do we create an environment where they can also heal and recover from their trauma? And I think everything that we do for the young people and families we work with, we need to be thinking about ourselves and our colleagues as well. We had a lunch and learn event at the UK Trauma Council community practice just a couple of weeks ago, where Carla Croft, who runs the staff support service at Bart's Hospital, spoke about how important it is, and so much of it comes back to relationships as well, and services setting themselves up in a way that supports and nurtures their staff rather than just sees them as a kind of a machine to put through whatever the clients are. So I think it's really important, and there's much more. Maybe we could do another webinar one day about how we help people to do the job.
Definitely. Thank you, Daisy.
No, thank you so much, David, for picking that one up. I've got a couple more, but for anyone who hasn't asked a question, please do use the Q&A. If you pop it in the chat, it might get lost because it's nice and busy in there. But one I did pick up from the chat was, and I'll just read the question out verbatim. Would such a child who has become a victim to domestic homicide automatically receive social worker support? Or is it only in specific circumstances? Open up to the floor.
I mean, my experience is that normally, but not always. So I've certainly worked with some families where a family member has swooped in and scooped up the children, looked after them, and the local authority kind of have a look to make sure that it's good enough, and then they've got plenty of other things to do. But more often than not, the local authority, the social workers would get a bit more involved. That's been my experience anyway.
Yeah. Sarah, because I know you touched on this, do you want to add to that, your experience?
Our experience has been when it's organised where they're going to live, and that's happened. And then after that, when families are still reeling, the support has gone for them.
Great. Thank you both so much. Susan has asked in the Q&A, thinking about stopping control from imprisoned parent, how can we do that while supporting contact if it has advantages for the child, as per David's points?
Yeah, thank you. That's again another important question. It gets complicated, doesn't it? I think for me, when I got involved at that stage, so helping the court to make useful and well-informed decisions, it just takes time to stop and pause and think, what is best for the child or young person? This is not about the rights of someone who's now in prison. This is about what is best for the child, and to actually hear their story and understand what's going on for them so that we can then work out what's best for them. It takes time and patience, and going back to the theme of today, relationship. If I'm doing an expert witness for the family court, I can't turn up and see a child at 3 o'clock on a Friday afternoon and in 1 hour extract all the information I need. It's not like taking blood for a blood test. You've got to develop that relationship so that they can tell me what's really going on for them and whether they really want to see that person or not, because they may have other people's stories and ideas. They may have been told, make sure you tell him this. And I think it takes time. And I will stop talking in a minute, but especially if the message of the trauma is don't trust other people, and suddenly they meet this stranger who's asking them all sorts of questions, I think that's not always the best way.
And I think it is another webinar as well, is the role of shame for these children as well, and those layers which then may prevent them without time to be able to say what they're really thinking and needing.
Yeah.
And can I just add, the experiences that we have at Children Heard and Seen, it's when it's been the paternal grandparent grandparents looking after the children, and it has been their son. They have minimised the offence, and the adults now that are in part of the focus group really talk about that and feel quite angry that it was, and that they felt that they didn't want to upset their grandparents. They were upset enough in terms of what their father had done. It wasn't, as David said, it needs to be looking much more at what it is for the child and not for the adults around them.
Yeah, and give them that voice that we've spoke about as well with time.
Yeah, thank you, everyone. Joanna's asked in the Q&A, in terms of contact with the parent in prison because of domestic homicide, how do you assess risk to the child due to factors such as ongoing coercive controlling behaviours and therefore potential attempts to manipulate the child and also professionals?
Yeah, that's another really important question. It is complicated and it takes time, but I still think it could be done carefully. So I've certainly been involved in cases where I've helped the court to think about, and the families to think, is contact a good idea for the child? Is it going to play some sort of useful role for the child? And then we would help the person in prison to make sure that the child makes the most of that intervention. We'll think carefully about what they might say, how they might answer their questions, and I might sort of help them come up with their answers in advance. And then it needs to be supervised. And if things don't go to plan, then we stop it very quickly. So I think you're absolutely right. It's not straightforward and there are risks, but I think we can mitigate many of those risks.
And I think it comes back to that principle of choice as well for that young person on their recovery journey, doesn't it, that you spoke about as well. But they can only make that choice if they're supported and safeguarded with the systems around them, so they're not re-traumatised or the abuse from the system.
Thank you all. Ruby has asked if there are any recommendations on supporting these children as young adults when they find themselves begin to think about starting a family or they find out that they're pregnant.
I mean, Sarah, I think it'd be great to hear from you on that one, because that's exactly some of the work you're doing.
I think that's what's missing in services. That's what we're finding. So these adults having come together, we haven't been able to find anything else like it in terms of a support network. And as I said, it's not a therapeutic group, but we would like to develop it in terms of that. But what we're doing it is as a focus of what they would like to change. But we haven't been able to find. So if anybody has, any resources or know of anything, then we'd love to know.
Yeah, and it's definitely the experience that we find, for baby's sake as well, when you're working with those parents, that pregnancy is such a time when those memories impact on their future parenting without the right support, don't they? And again, another webinar.
Okay, I'm going to squeeze in one more with this minute and a half that we've got left. Another final one, multi-agency working is so important. How do we connect and mobilise the network around the child to support them?
I'll answer that very quickly. Donuts. I think we have so many of these meetings online now, we are missing, going back to where we started, the relationship with other professionals. If I go along to a meeting and I take donuts, we immediately start talking about donuts and sugar and favorite foods. And there's just that little glimmer of a connection with this fellow human being. Even if we've got different ideas about what's best for the child, we've connected first, and then we can have a conversation about what we think's best for the child, because we have two things in common now. We both want what's best for the child, and we also are eating donuts. So I think there's something about relationship between professionals and investing time and money in that.
Yeah, ditto. I want to come to a meeting with you with that donut. So, David, it is 14:59. I just want to say huge thank you for everyone, your questions and contribution in the chat, and to David and Sarah for, amazing presentations, and being really putting the spotlight, but also bringing us hope and keeping the baby and child's voice at the centre. And please do sign up to our mailing list at the For Baby's Sake Trust. Go over and look at our resources too, including the emotional safety plans for professionals to really support us all in this work, because if we don't keep us safe, we're not able to be there and present for our babies, children and families. So a huge thank you.
Thank you so much, everyone. Thank you. Just quickly, David or Sarah, is there anything else you want to add before we stop the recording?
No, only.
Oh, I think you cut out there for a second, Sarah.
I think only that if anybody does want to see the film, get in touch and we can send it if they missed it, the YouTube film, or anyone wants what children wanted when they were children, and what adults wanted when they were children, do get in touch.
Yeah, they absolutely do, Sarah. Lots of enthusiasm for that in the chat, so we'll get that sent round to everyone who has been in the room today. Any final words from you, David?
No, just thank you everyone for your time.
Amazing. Great. Thank you all so much. We'll see you at our next webinar. Thank you.
Thank you.